Hello, everyone. Research is not always about finding new answers. It's about daring to ask better questions, challenging the current practices, even when the answers feel uncomfortable. They say anesthesiologists put people to sleep, but the articles in the September issue might just keep your brain wide awake. From next generation imaging to forgotten anatomy and controversial blocks, you're in for a ride through the future of perioperative care. Welcome back to another episode of From the Editor's Desk, your monthly insight into the heart of academic anesthesia, brought to you by the Indian Journal of Anaesthesia. I am Dr. Karthik, and as always, I am thrilled to be your host today. As we flip open the September 25 issue, there's a plenty to look forward to. From cutting edge airway strategies to thought provoking editorials, insightful meta analysis, and regional anesthesia innovations that are bound to stir discussion in the ORs and ICUs across the country and beyond. But before we dive into the pages of this journal, I have with me someone who truly needs no introduction. He's the driving force behind this academic odyssey, a researcher, an innovator, educator, and a visionary. Professor Dr. Rakesh Garg, Editor-in-Chief of the Indian Journal of Anaesthesia. Sir, it's a pleasure to welcome you once again to the podcast.
Thank you, Dr. Karthik, for this wonderful introduction. Thank you so much to all the readers for waiting for the IJA issue to be released. And as Dr. Karthik mentioned, many new things for the clinician and also for researchers to follow from this issue as well.
Yes, Dr. Rakesh. Like academic publishing isn't just about impact factors. It's about the impact it actually creates in the operating rooms, ICU, and most importantly, in the patient's lives. This issue really seems to be like a treasure box, right from the video laryngoscopy advocacy to meta-analysis on the sacral ESP and the pediatric misguided anesthesia. Could you start by telling our listeners what is the overarching theme or the editorial intent behind this month's issue?
Absolutely, as is usual, the norm of Indian Journal of Anaesthesia, and it reflects the commitment of the journal towards the based practice in the field of anesthesiology, critical care, and pain medicine. And similarly, the September issue of IJA 2025 again reflects the important aspect which will be having a good amount of clinical translational value by its editorials, by the systematic review and meta-analysis, the original articles, and definitely some of the comments, the brief communications and the cases as letter to editors are again brings a different insight into the perioperative management as well as critical care management, and this is what is being brought in the September issue of IJA. When we talk about the editorial is brings about insight into what is happening across the world with regards to some controversial aspect, some ongoing aspect, something which needs some further research because there is still some controversy exists that which is best, which is not. And it also helps at times wherein the editors wants to emphasize the importance of certain very important aspect, and same will be the art of writing a title, isn't it, Dr. Karthik? So
Yes, very true.
read a paper, if the article is interesting, it should reflect in the title itself. So that's why we have tried to bring the science of art and writing, of systematic review and meta-analysis. IJA has been published good quality and good quantity also of the systematic review and meta many months now, and this will be providing a altogether package of writing a precise, well structured, to the point, based on the key points of that particular manuscript, enhances the clarity. And then, as you also mentioned that when we want to release a paper manuscript, it should be able to be searched by the people, and title is one of the key things by which the article would be searched. So discoverability, and then finally the scientific impact. And then again, interesting two articles based on video laryngoscopy. Recently, there have been guidelines, there have been controversy for universalization. Some people believe that this is a good tool, probably a cost-effective one. should be used, and the conventional direct laryngoscopy should now go into museum. This is what has come into this two editorials of a specific set of population and using it universality. Yes, there is some dilemma when we talk about low resource settings, when we have limited resources. Yes, a dilemma happens, but this editorial will give you some insight into the beneficial advantage of video laryngoscopy, and probably in near future we have to think of universalization, keeping all aspects including the cost benefit analysis of using the equipment, because it's little costly than the direct laryngoscope, but yes, it has many advantages. So let's see how it turns into the clinical practice. Now going on to the another section of the journal, which is systematic review and meta-analysis. We have been talking about the use of BIS, and when we talk about the BIS guided anesthesia practice on the recovery profile of pediatric age group. Now when we say pediatric age group, it becomes very important to understand that the recovery should be smooth, the emergence should be smooth in these patients, the reflexes should be maintained. This is what the requirement is, and hence we have to somewhere use some tool to measure it, and there have been many studies, and herein it brings an systematic review meta-analysis wherein you have mentioned about the BIS guidance, and it says that it improves the recovery profile of the children when it is used in pediatric population. That's again a good meta-analysis wherein we should start thinking of that we should monitor the anesthesia using some monitoring tool, and BIS, since one of the common tool, we may start using them. Now a lot of papers are coming, including in IJA, about the facial plane blocks, and when we talk about facial plane blocks, we have to think of the various sites and different blocks. Many studies are coming up, and again interesting systematic review meta-analysis where the authors have tried to find out the efficacy of ultrasound guided sacral erector spinal block for perioperative analgesia in elective surgical procedures, and they have found that it is a promising tool, and we know it is a promising tool, but now we have got concrete evidence, and it should be a part of multi-model management of the elective surgeries. Now, these facial plane blocks are being used for different places. This is with regards to the sacral ESP blocks, but yes, we need to look for the other blocks and similar efficacy for good perioperative analgesia. Now, when we talk about the pain medicine, IJA also covers the domain of pain medicine, and there have been a lot of issues with the shoulder pain, sometimes maybe because of frozen shoulder, some inflammation, some injuries, and various therapies have come up, whether it's a nerve block, whether it's some other intervention, some physiotherapeutic exercises. There have been many things, and one which has emerged in recent years is the prolotherapy, and again using the dextrose for this purpose. So this is what again a systematic review and meta-analysis where they have tried to find out the utility of dextrose prolotherapy in patients who have suffered from rotator cuff injuries, and they found that it is safe, and it moderately improves the outcome of these patients who has chronic shoulder pain because of such injury procedures. So this is Dr. Karthik. The IJA has brought the interesting evidence in the form of systematic review meta-analysis, and again we have a couple of very interesting original articles also in this issue. Now when we talk about the airway management, yes, it is challenging for anesthesiologist, but if I say airway management in patients with head and neck surgery, Dr. Karthik, do you think it is sometimes more challenging because it is an anticipated difficult airway, isn't it, Dr. Karthik?
Very true, very true.
So now when we say head and neck surgeries, these patients usually have imaging prior to surgeries because cancer patient would have. Why not to use these modality, imaging modality, and explore more by 3D reconstruction and virtual endoscopy to look for how the airway actually looks like, whether we will face some difficulty in these situations. We need to explore those aspects, and this is what the authors conclude, that the preoperative reconstruction of the airway from these existing CT scans in patients undergoing head and neck surgeries will have some role in overall management. Nowadays, a lot of intravenous anesthesia is being propagated. The global warming, the OT pollution, the recovery profile, many aspects are coming up. And this issue mentions an RCT in which the authors have compared TIVA with volatile based inhalation anesthesia. And they have found out another important aspect of the GI function recovery. We are always concerned post-op nausea, vomiting, gastroparesis and those things. Now these authors have tried to identify whether these patients will have any impact of TIVA versus volatile agents, inhalation anesthesia on the recovery profile, and they found that TIVA is favorable for faster GI recovery. And this is what one of the important component of ERAS protocols. Authors believes that TIVA will be able to enhance the recovery by improving the GI function in these patients. Also, as I mentioned earlier, when we talk about airway management, 3D imaging we have already reconstructed. The authors have come up various measurements of the airway assessment tools, and they have tried to predict the difficult airways from this aspect. They have tried to look for the tongue height versus oral cavity height ratios and neck circumference measurements, and they found that these are the valuable tools in predicting difficult airway, and they're simple tools which can be easily done. The ultrasound is available now bedside and can be done. Now the another challenge for anesthesiologists which is coming up is the post-operative delirium. And when we say delirium, it could be immediate post-operative. Sometimes these patients are in the intensive care units and they manifest delirium. We know that the concern, challenges and complications when a patient manifests delirium is multimodal. There are many things, and in this study, which is actually a retrospective cohort of a large population, they have tried to find out the predictors of the delirium in the ICU setup after the surgical procedure, and they found that the A's and various intraoperative factors. A's we cannot change, but certain intraoperative factors we can always do modifiable. So non-modifiable factors are also there. So this emphasizes the need of understanding the occurrence of delirium and taking various factors into consideration which we can modify and prevents the occurrence of delirium. So again, a very important study which will improve the outcome of these patients, lesser number of delirium, reduces the complication. Again, an interesting study. Now we also have the ultrasound being used for various purposes. We know ultrasound is being for vascular purpose, for regional blocks, but also it is an important tool to understand what is happening inside the brain. So for neurosurgical procedures, the ultrasound can be used for measuring the optic nerve sheath diameter, and in this study, which is a prospective observational study, they have tried to identify, and they mentioned that the optic nerve sheath diameter is one of the non-invasive repeatable tool which can be easily done bedside, and it can tell us the changes which is happening in the intracranial region, whether there are some fluctuations in the pressures there or not. We have again another important regional anesthesia related article where the authors have compared the ultrasound guided supraclavicular nerve block combined with the clavipectoral facial plane block, popularly known as SCUT block, versus supraclavicular plus upper trunk block for clavicle surgery. Now clavicle surgery is always challenging, quite painful. A patient needs to be having early recovery. The lung functions should be appropriate. If patient is having pain, he will have splinting of the breathing aspect. He may not breathe well, and then there will be post-operative pulmonary complications. So they have found that these type of blocks are effective, and they provide consistent analgesia with lesser amount of perioperative other analgesics requirement, and probably they are good for these patients. We also have another article when we talk about the patients suffering from chronic pains. So authors have tried to use the knee pain for patients with suffering from knee pain for radiofrequency ablation for chronic pain management, and they found that in selected group of population, when this radiofrequency ablation is being done for a specific nerves, it improves the pain-free duration in these patients, and the quality of life probably we can extrapolate will improve upon these patients. And definitely we have a couple of very interesting commentaries and responses from the authors which emphasize that the authors, the readers are reading these papers very well. They have their own comments, and IJA always welcome people to comment upon the published article to bring more nuances, more clarity, more a different way of interpretation. So I always welcome these type of comments to the published articles, and I'm very glad to see that a lot of comments which are very constructive, feedback which is coming up, and they provide a different thought process, different viewpoint of those published articles which has been published in this, in addition to this letter to editors which emphasizes on the front block. They also talked about the anatomical variations in the nerves, which is again an important article. So this means the September issue is full of academics, full of evidences. Go through it. I'm sure not only it will increase your knowledge, but also you will be able to provide better evidence-based approach for the patients requiring perioperative care, patients requiring pain management, patient requiring management into a critical care setup. So I'm sure it will be not only a fun, but the high quality articles in Indian Journal of Anaesthesia and September issue. You'll be really getting a lot of informations, latest informations from this issue.
Very, very true, sir. I'm sure after listening to what you have told about the issue, I'm just eagerly waiting to start reading all the articles from the journal, as so as our readers would do. Sir, as a basic beginner who has started reading the journals, could you tell our listeners what an editorial really is in the context of a medical journal? How should a reader see an editorial? How should he approach it? And what does it truly signify, like about the direction or voice that of that issue?
So usually editorial is coming from it's an editor's voice, which could be related to the journal directly, or sometimes it comes from a person who is an expert, an experienced person in that particular field. Now, when we say editorial, it usually highlights something which is thought provoking. Sometimes it could be because of the controversial aspect. Some articles says it is better, some says it's not better. Authors have published their hard work, but every time we can look on those published manuscript, because editors have gone through them, they can look off the other nuances which may be at times related to limitation of that article, or sometimes we want to extrapolate it to provide some beneficial effect on a bigger platform. Also at times, sometimes a new things comes up, a new blocks comes up, new techniques comes up. Authors would have done those techniques, strategies, drugs into a the sampling site would have some restrictions. There may be some inclusion exclusion criteria. There could be some biases, confounders. So now when we want to understand those finer aspects, an expert can do it based on the experience, a research-based experience, a statistical understanding, or on the basis of experience. So it brings a new insight into the published article, and that's why editors, based on their experience, try to provide a different perspective of the published articles. So that is always interesting, and many of the times it will always give a clue of the future research, what needs to be done. So look into those editorials, and you will find if you are a researcher looking for a topic, there are a couple of ways to find a topic. One is the editorial. Second is if you see the last paragraph of any published manuscript where we emphasizes the need of writing a paragraph called limitations of the study, and that limitation becomes a thought for the next study. So this is provide you a ready-made place where you can think of your next research.
Agreed, sir. Agreed completely. whenever we are scrolling YouTube or something, we usually click on we want to see the video only if we like the thumbnail or the title. That is a catch. So, in this issue, you also co-authored the editorial about crafting impactful titles. Could you share a surprising insight or a pet peeve about how titles shape the research perception?
Absolutely, I think this is important because, as you just mentioned, if you search something, if you go to a market, if you search a book, what is the first thing, Dr. Karthik, you will look for? The
Definitely the title, the cover page.
the cover
Uh,
page, which will have the
yeah.
name of the book.
Yes.
If you go to a shop, you will see the title and see what this shop is for. If it is a branded, well-known one, you will not thinking twice to enter it and purchase something. Similarly, when you read an article, the first impression of a reader to enter the manuscript will be through the title. And when we say title, it should be, sometimes we feel that title should be very attractive, very catchy, fancy words. But on the other side, this editorial mentioned that it should not be always fancy. It is what should really depict in a brief statement with few words actually what you have done into the manuscript. There are various ways of writing the title, but we have emphasized various do's and don'ts that an author should do while they are writing the title of your paper. And I will also suggest at this point in time, usually for ethical approval, for CTR registration, we usually write the title first. But when you are sending it for publication, it's fine that if you can change a little bit. Write the title and the abstract at the last, because now you know what your paper conveys. You are absolutely clear at what was your conclusion from the paper, and hence your basic keywords should be there into a title. If you talk about the randomized control trial or any original article, the type of study, and those keywords should be there so that people will see the paper, the title, and they will think that this is of their use. Number one. Number two, when we have so many things, so many millions of articles published over years in many repositories, and you have to search. The search will be based on the title or the keywords usually, and if your title is not matching correctly the core content of your manuscript, it will not be discoverable by the people who are searching the repositories or through various search engines for finding your article. So your hard work, your research work will not get its true benefit to the patient because somebody is not able to find it appropriately. So there are many benefits. I will not disclose all secrets here. So I think this is the important point. I will request you to visit a website of the Indian Journal of Anaesthesia, click on the September issue, click on the editorial, and really you'll have some important graphics, tables, do's and don'ts, and you will really, I think it will be an insight for you to write a good title.
Thank you for leaking not all, but definitely a few secrets, sir. Sir, as a editor in chief, you'll be utmost happy not when the article is actually approved and published, but that published article is really putting some value in the operating room or the ICU. So, how many articles do you think are really turning out to provide value in the actual clinical practice? And what do you think is the conversion rate from just a study to the implementation in the clinical practice?
I think this is a very, very important question, Dr. Karthik, you have asked. Absolutely. When anybody, I will talk about myself, when I read an article, I just think a couple of things comes to my mind. Leave apart the methodology or the analysis or something. I also think what will be its clinical translational value. And sometimes the research, which are primarily the basic researches, they are done to understand certain basic aspect, like for example say drug pharmacokinetics, their impact. So those basic sciences are equally important, but when you do a clinical study or a clinical trial, you need to understand that whether they will be translated into your clinical practice. And that's why IJA has been encouraging people to publish the systematic review and meta-analysis. So when an article is being published, I usually flip based either on my experience, and sometimes I usually flip certain search engines to look for how many similar articles has been published. And sometimes based on this, if we think that say 3 studies mention it's very useful, 1 study mention it's not so useful, I think the literature is not going to one direction. And if this article comes up, at least it will support in one direction, and this will be future for systematic review and meta-analysis to generate the evidence. So this is the you can say the cycle of the article, starting from the original article, going to the systematic review and meta-analysis, going to the guidelines. And when these guidelines comes up, then definitely they are being followed. Though at times we understand that the compliance to guidelines is also at times not good. Probably people have their own experiences in that particular area, and sometimes they believe on those experiences, and that's absolutely right in certain aspect. But sometimes when things are emerging, new equipments are coming up, new strategies are coming up, every probably few weeks to few months there will be new facial plane block which is coming up modified or some other version. So when these are new are coming up, they are coming new because we are able to understand them better, we are able to understand those facial planes better, and hence people, researchers, clinicians are bringing those newer things. So these have to be taken forward, and once a couple of papers published, the synthesis of the evidence is done and the guidelines are created. So I think that's equally, and once the guidelines comes, probably we get some robust evidence majority of time if there have been some good randomized control trial with showing some directionality to a particular technique or a strategy or a drug, and we can definitely change into a clinical practice to use the latest one. So this is the journey of the manuscript from the researcher's office to the patient outcome, and this is how the words of a research moves on.
Understood, sir. Definitely, there is a lot of clinical implementation of all these studies, I believe, because every study is robustly, you know, all the indications, contraindications, everything has been studied. The methodology has been quite nicely designed in the recent publications also. There is a lot of impact, definitely, in the ORs and the ICUs. Definitely, a lot of interest has been already created regarding the September 2025 issue. I would like to end with a fun question, sir. I wonder, is there any one submission you received in this issue that made you go like, "Wow, I wish I had done this study"? Is there
Yeah,
anything like that?
absolutely. I think the number of submissions to the Indian Journal of Anaesthesia is increasing because IJA is publishing good quality articles from across the world, and number of submissions has increased almost double in last 3 to 4 years. So this is just showing not only the enthusiasm of research, but also the popularity of IJA and its credibility and the quality work being published into the IJA. Now, when I see these articles, these are the selected articles. Usually, we say that number of articles got rejected. I usually repeat those sentences. It's not that these articles were bad, but probably we have to take top articles. And when this is top articles, this means based on the novelty, the methodology, and many other aspects, they comes on the top. Other articles are also good. So they always have when they come for a final proof for check. I always realize I read all articles full, the whole issue. As a part of my proof check, I go through each page and each word, and definitely I think my gray cells are getting more, newer informations, the hard work of the researchers, and probably indirectly it is helping to give better care to my patients because even before it is released to the people, to the readers, they are already released to me. So I am little happy that I could read it before the others read, and my patient care becomes shade better. And this is what a wow comes when I read these papers, and I think the articles, the researchers' work is really, really very good. And I need to thank each of the authors and researchers who are showing their faith for submitting their hard work into the Indian Journal of Anaesthesia.
Thank you so much, sir. Is there any final last word you want to tell our users about the September issue, what they can be looking forward to?
I think go through each article, interesting one, depending upon your choice and taste. It has combination of everything in this issue. Regional block to ICU, pediatrics to adults, original articles to systematic reviews to editorials. Everything is there in this issue. Go through them and enjoy, and do give us feedback if you find that some different narrative or a different prospect you can try to analyze these articles. Feel free to submit them as comments to the published articles, because we also look for looking the researchers work from a different angle. So feel free to submit them up. Keep reading IJA, keep submitting to the IJA, and we ensure that a timely publication in the IJA is ensured.
Thank you so much for boosting up our enthusiasm, sir. Dr. Rakesh, sir, thank you so much for taking us behind the scenes of this rich and exciting issue. Your perspective always helps bring the science to life. And to all our listeners, if you have ever doubted the power of research, just remember every protocol you follow today started as someone's wild idea yesterday. I can't wait to dive into this issue myself, and I hope you are just intrigued as me. Whether you are an anesthesia resident, researcher, or a consultant looking for answers between the cases, this issue has something for everyone. Go ahead, read it, share it, and as always, stay curious. Do subscribe to the channel and see you in the next episode.